I guess I just wanted to start by, sorry, I got an alert on my screen. I just wanted to start by thanking the Kellen Foundation for the work that they do to improve their communities that they serve, and the supports that they offer individuals and families just to overcome the significant challenges and lead the life that they want to. As I was registering for the event today, I read over the agenda, and I just think we are going to get a great overview of how addiction and trauma shows up in our communities. And I believe that the rest of the speakers are going to have some very interesting and valuable insights and observations to share with us. My goal for the time that I have this afternoon is just to provide a general overview of substance use disorder in North Carolina, specifically as it relates to youth. And before I do this, I wanted to give a basic overview of where the addictions team sits within the state. And on the next slide, if we could go to that, you can just see that the Department of Health and Human Services is the parent agency of my division. And then we have the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. And under that is the policy and program design teams, of which the addiction team is one of these. And again, on the next slide, I just wanted to give everybody an overview of the actual addictions team with the division. So currently there are 18 individuals that cover a wide range of service areas. Unfortunately, I didn't have the space here to include each person's contact information, but if you would like that information, please, reach out to me and I will get that to you. So I have quite a lot of data that I just want to share with you guys. So understanding that time is limited, I will just jump straight into it and keep going. So I wanted to start with just talking a little bit about the prevalence rate of substance use disorder amongst youth. And I've actually broken this down into two categories, two groups. I have youth aged 12 to 17, and then transitional age youth, that 18 to 25 age group. The 12 to 17 age group has a prevalence rate of 3.91%, which means there's an estimated 32,262 youth experiencing a substance use disorder in North Carolina. Then if we add in that 18 to 25 age group, they have a prevalence rate of 13.68%, which means there's an estimated 162,592 transitional age youth experiencing a substance use disorder. So the most common substances being used by North Carolina youth are tobacco, and this includes, in here I'm including e-cigarettes and vaping. And it's interesting where the data during the last kind of year has indicated that the e-cigarette and vaping use among youth has been declining over the last year. But I guess I have concerns that we will see that trend back upwards with the reintroduction of in-person schooling and events and just kind of, those general getting together. So it is going down, but I would expect that to go back up again. And then other substances that we see quite a lot of are alcohol, cannabis, and then prescription drugs, including amphetamines such as Adderall, and then painkillers such as Vicodin and Oxycontin. And the next data point I have here is just about uninsured youth. So regarding that, there's an estimated 5.4% of newborns to 18-year-olds in North Carolina that have no insurance. So this 5.4% represents roughly 104,097 youth. And for quite a while, North Carolina was doing very well in reducing this number. From 2008 to 2015, North Carolina saw a drop in that number each year. In 2008, we were at a high of 10%, and we got that down to 4.6% in 2016. And then since then, that number has risen each year. And again, with COVID-19, the pandemic, I'm concerned about how that will impact our uninsured rate. You know, we have parents, caregivers, guardians have lost jobs, are losing jobs, and with that, they're losing that employer-sponsored healthcare coverage. So that's a concern for me, and I'm sure a concern for everybody. And I guess I just wanted to highlight some alternative data sources as well. That uninsured rate came from the Department of Health, but Georgetown University actually has a program called the Center for Children and Families that examines healthcare coverage in each state. And they currently estimate that North Carolina has an uninsured rate of 5.8% for youth. And so that translates into 142,000 individuals newborn to 18 with no insurance. And I think we're all acutely aware of how the lack of healthcare impacts individuals, and especially in individual youth's chances of growing up to become a happy, healthy, productive adult. And I'm sure we all know that there are over 1 million adults here in North Carolina without healthcare coverage. I also just wanted to share that the most recent data for the number of emergency department visits for unintentional overdoses involving medications or substances with dependency potential. As of April, for April of this year, we saw 1,359 emergency department visits, which brings the year's total up to 5,119. So this actually represents a 21% increase compared to the same period of 2020. And off the 1,359 ED visits for April, the 15 to 24-year-old age group makes up 18% of this number. So I actually went back to the Division of Public Health, which publishes this data, and I asked for more specific data on the 15 to 18-year-old age category. And they've told me that 15 to 18-year-olds, they accounted for 4% of this number in April, which translates into 56 individuals between the ages of 15 to 18 visited an emergency department for an unintentional overdose. I don't have any specific data for youth on the next data point, but I do think it is worth sharing regardless. Just due to the way numbers from each county are reported, the 2020 data on the number of overdose deaths is still listed as provisional, but we do know that in 2020, there were 2,451 confirmed overdose deaths in North Carolina, and 83% of those involved opioids. If we could go to the next slide. So I just wanted to take some time and highlight an area that's of particular interest to me, and that's just the co-occurring nature of substance use disorder. You know, various studies and research just suggest that anywhere from 60 to 75% of youth that experience a substance use disorder also experience a psychiatric disorder, with the most common being major mood disorder, an anxiety disorder, or a conduct disorder. And I think an often overlooked problem is that of problem gambling. In North Carolina, there's a prevalence rate of between 4.4 to 7.4% for youth who meet the criteria for gambling disorder. And the current research on problem gambling is suggesting that for individuals who experience problem gambling, 50 to 60% meet the criteria for a substance use disorder, 50% meet the criteria for a mood disorder, and around 40% for an anxiety disorder. So the reason I highlight co-occurring disorders is because it's clear that individuals, both youth and adults who experience a substance use disorder, will likely experience another disorder at the same time. And so I think it's imperative that we screen for co-occurring disorders and provide the appropriate diagnosis and treatment that addresses the complex nature of how these disorders interact with each other. moving on, the juvenile justice system is another area that we see significant numbers of youth who experience a substance use disorder. In 2019, the North Carolina implemented the Raise the Age legislation so that 16 and 17-year-olds are no longer automatically charged as adults for many crimes. And the initial impact of this legislation was that in 2019, the juvenile justice system experienced a significant increase in the number of youths that it came into contact with. And ultimately in 2019, it served a little over 20,000 people, with over half of those individuals experiencing at least one substance use disorder. So that's quite a big number. And lastly, I just wanted to touch on trauma, because I think it's an area that is particularly relevant to this group. And we all know that adverse childhood experiences cover a range of potentially traumatic events and environmental factors that can occur in the lives of youth. We know that these adverse experiences have a damaging effect on overall health, well-being, and life outcomes. And we know that the more adverse experiences a youth has, the greater the likelihood that the experience will have a damaging impact. And for example, youth who experience 5 adverse childhood experiences are 7 to 10 times more likely to develop a substance use disorder. But likelihood does not equal certainty. And I think there are many protective factors that help lessen the impact of adverse experiences, and programs such as those offered by the Kellen Foundation assist families in creating those opportunities to promote resilience and recovery, and assist individuals and families in developing the skills to protect themselves from the long-term impact of trauma. And I looking at time, I'm aware that I have no time left, but I want to just cover the last few slides if that's possible. So I just wanted to highlight some of the programs that the addictions team is responsible for overseeing. The State Opioid Response Grant is funding to North Carolina from the federal government to address the opioid epidemic. And this year and next year, that funding is a little over $35 million per year, which with most of that funding going directly to treatment costs. In addition to the direct treatment costs, the SOR funds have been able to support several pilot projects or pilot initiatives over the last few years. And these have included programs such as alternative pain management, opioid use disorder identification and treatment in emergency departments, and a number of family preservation programs with DSS agencies across the state. The PPW program works to expand access to family-based services and other evidence-based programs for pregnant and postpartum women with a primary substance use disorder. And the project also works to enhance the care coordination across various systems. The North Carolina Problem Gambling Program provides and supports access to effective gambling prevention, education, outreach, and treatment services. And the Problem Gambling Program offers grants to schools and community-based programs to implement an evidence-based education program. They also offer resources to families, clinicians, and educators, and they offer a number of trainings throughout the year for people. And then the last thing I just want to highlight there is the Substance Abuse Prevention and Treatment Block Grant. And those are funds that are used to provide prevention, early intervention, and treatment and recovery supports to individuals across North Carolina. The vast majority of those funds are allocated each year to the MCOs to ensure that there are appropriate services to adolescents and adults without insurance, and to provide services not covered by Medicaid or private insurance. One of the last things I wanted to highlight as well was just a number of resources. On the next slide, if you have a copy of this presentation, I'm sure Dr. Graves can email that out to people if you don't have it, but each resource there, I have included. If you click on it, it will link you to that resource's website directly. And just to highlight a few of them, under North Carolina, I have included a link to the MCO directory. I've included a link to SYNC, who provide just various resources for communities and families, as well as coalition building work. And then ADCNC is a great resource for information and referral sources. Under the general resources tab there, I've included Shatterproof, and they are a national agency that provide advocacy and education. And they also have a very useful treatment locator tool on their website. And then finally, for those who are interested in the data side, or who want data to back up their advocacy work with strong data, and those who are just filling out grant forms or funding applications, I've included a number of great resources for that under the data, surveys, and other section. And I guess finally for me, I just kind of wanted to just share with you guys, what my priorities are for the adolescent services arena. And I really want us as a state to make progress in identifying and in improving the screening for early detection of substance use disorder and other co-occurring disorders. I want us to make progress in improving the adolescent SUD workforce in terms of how we recruit and how we retain well-qualified and skilled individuals. And I think we need to make progress just in examining the adolescent SUD treatment system and ensuring that there is access to appropriate care across the state. So for me, I would just like to close by giving a big thank you to Kelly and say that I hope that as we continue to ease our pandemic restrictions, that I get the opportunity to meet with everybody in person and to listen to your experiences and your hopes for the future in terms of what we can be as a state. So thank you. And I know that was rushed, but I wanted to get it all in as quickly as possible. So thank you, Kelly.
Absolutely. Thank you for joining. And while the Kellen Foundation is really honored to do a lot of this work, we have some really amazing groups in Guilford County that certainly add to the array of services that we're able to provide. And as you highlighted in the data, we certainly have a lot of room to grow and a lot of gaps to fill, and evolutions that need to continue to occur to best provide support for kids and families across our community. Thank you so much for sharing a snapshot of the state landscape. Eamon's contact information is here, and just so that you know, we'll provide a summary of this information and the links that were in the PowerPoint for you after the meeting. You'll get a follow-up email that has all of that information in there as well. So thank you so much for joining us today. And so as we move from the state into the kind of local Guilford County arena, wanted to share a little bit about what it can look like in day-to-day practice. And so we have three of our child and family advocates here, Angela Sadlowski, Lisa Taylor, and Melanie Garner. And they're going to just highlight a couple case examples of the ways in which addiction can show up in ways that we may or may not expect. So passing the mic to our CRI team.
Thank you, Kelly. So I'm going to keep this really short and sweet. Thank you, Eamon. You covered a lot of really pivotal information that is super relevant to what CRI does. So for those of you who are not familiar, my name's Angela. I'm the CRI team lead. And basically what CRI does is we work with community partners, law enforcement agencies and health departments, et cetera, to support families who are in need of resources, experiencing mental health or substance use disorder crises, et cetera. So the way that we see addiction and substance use disorders show up in our CRI work, referrals that we receive come from a variety of places. The number one most important thing that we try and keep in mind is that, and Eamon touched on this, when we are seeing families that are involved with the justice system, whether it's juvenile or adults or family systems, a lot of times there is a co-occurring component contributing to the behaviors or the scenarios that would result 911 call and a CRI referral. So Miss Lisa Taylor, she is one of our advocates, and she is going to give kind of a summary of a case that kind of highlights the overarching effects of addiction and mental health disorders, and kind of impact families in our community, and how CRI, Callan Foundation, and all of our partners, many of which are on the call now, how we kind of work together and collaborate to provide at least, a safety net to support and foster that resilience in families. So with that, Lisa, it's all.
Good afternoon, everyone. Thank you so very much, Angela, and thank you, Ewan. That was wonderful. And again, just to kind of go over just one particular case, we get so many different cases that come through, but of course, protecting our families and us being, definitely HIPAA conscious, we would never give out any direct information. But one of the cases that really stands out for me is I got a referral that had 4 children that were on the case and on the incident report. And when I tried to reach out to the mother, when she first picked up the phone, she was ramping and raving with, how did you get my number? And, I think she definitely was intoxicated. There was a lot going on then. And then she kind of slammed the phone down in my face. And one of the things that we do as advocates is once the officer gives us a case report, most of the time they will put several different numbers, whether or not they're numbers from neighbors, from maybe some of the older children and so on. So I contacted another number that was on there. And surely the person who picked up was the 18-year-old. And when she picked up the phone, she was so happy that I was calling, but she also made me aware that she couldn't stay there in the home any longer, and that her mother, who had been using drugs, alcohol, also there was movement of not just drug paraphernalia, but also weapons. They were dealing out of the home, and again, with all the children there. And what she ended up doing was, she wanted the other siblings to go with her, but she knew that she couldn't get them with her. So she said if she got out first, that she was hoping she could get them. She said she was a punching bag for her mother. When her mother would be drunk, or either when she would lose something, just all the things we could think about with the dysfunction. And also she became the hero, if you will, of the family, because then she had to take care of those children because her mother wasn't available. She had men in and out of the home. She had, she didn't know who her father was, and all of the other children definitely did not have the same dad. So she struggled for long enough, and then finally she tried to commit suicide. And when that did not work, and this is her words telling me, when that did not work, she felt like she needed to live again because she needed to help her siblings. And it just tells you what we're dealing with concerning the pressure that the children have to go through once their parents are that dysfunctional and that disconnected from them. I know some of you might be saying, well, where are the grandparents? Where's the kin? Where's anybody that could help? And she actually did reach out to someone who lived very far out of state, and they got her out. So when she got out, her plan was to get her siblings. And when she tried to reach back to say, at least I can get the 15-year-old, because the ages we're talking about is like 4, I think 7, 15, and then, like I said, this young lady was 18. And the 15-year-old cried, saying, how can I leave now that you're gone? I can't bring them. There's no way for all of us together unless they take all of us. And so now you're saying, well, what about the resources? It is true that CPS was already involved. Other agencies were involved with this family. And I don't know how it happened, but she continued to be able to keep these children, even though all this stress was going on. So the only thing then we could do is obviously continue to just make other referrals, get someone from Guilford County, from the school involved, to say, listen, keep your eyes out on these children. But because of COVID, and this just happened, this case I'm talking about just happened in March, but because of COVID, they were home. So now use your imaginations to just think about what was going on every day with them not even going to school. COVID was a horrible thing, still is horrible, but for so many children, it was their way out. For so many children, it was almost their safety net for them to just go to school. And now they're home with all of this. So, that's just really short and sweet to the point. But, just to say how much of dysfunction is going on and how hard it is for the children to be able to cope. And even though, we can't go in and we can't take them, I could not meet her anywhere, I couldn't do anything physically, but you want to. In so many cases, your hands are tied, and then they just become a statistic, just like he went over all those statistics, and we're hoping that's not the case, but truly this is what we're seeing on a regular basis. Family Justice Center was definitely involved. All of our partners had a little piece of this concerning different phases of this family, but just to let you know that it's before us, it's here, and our children are screaming for help. They're screaming for help. So that's just one case.
And Lisa, thank you so much for sharing that example. Sometimes the data is really critical for us to understand that. And then we get to hear a little bit about, how that data plays out in the families and the stories of people across our community. And I think the example that you shared also highlights the fact that even if youth and adolescents are not using themselves, the addiction crisis impacts them. And so that's a really critical piece for us to keep in mind when we talk about going upstream and trying to use upstream approaches, which is like the trend right now, go upstream, right? We hear that all the time. A piece of that is identifying who is exposed to adults using substances to try to catch that early and do preventative work. Intervention work in terms of the impact, but then preventative work for development of substance use. So I appreciate you highlighting that case. And connected straight with the CRI approach, we have with us Captain Martis, who has been with the Greensboro Police Department since March of 2002. She currently holds the position as the commanding officer of the Criminal Investigations Division. And so under this division includes things like the squad's homicide, family victims unit, robbery, fraud, criminal intelligence, commercial property, residential property, crimes against person, violent crimes, street crimes. So lots of pieces that fall underneath Captain Martis's leadership. She's originally from Tampa, and we are thrilled to have her join us today. And Captain Martis is going to share a little bit about how she sees addiction show up in the work that she does.
Thank you, Dr. Graves. Good afternoon, everyone. Again, I'm Stephanie Martis with the Greensboro Police Department. And I just want to, before I even get started, I just want to express my appreciation to the Kellen Foundation and Dr. Graves for including law enforcement in this discussion. I think it's a collaborative effort with all the stakeholders and all of the partners in our community to face the aspect of trying to save our youth. And so those are like two loaded questions when you ask, how does addiction show up in the work that I do, and how do I view the crisis? I think in law enforcement, we have come to the point where we realize that we as law enforcement officers, we have to be more intentional when we respond to crises. And so we see it more as a trauma-informed law enforcement experience. Law enforcement response. So we have to be more trauma-informed when we're responding to a lot of these cases. I pulled a couple of statistics just because I just want to bring context to what I'm going to touch on. But I had my crime analyst pull some statistics for me. And so as of this year, May 15th, we've had a total of 303 overdoses in Greensboro. And I compared those statistics to last year, and last year this time we were about at 196 overdoses. So for the overdoses in total, but this is with juvenile and adults, we're about a 55% increase this time last year. And so I actually got some statistics that were that came in this morning as well. And so as of today, we're up to 342 total overdoses for the year. And for the deaths, Last year, this time, we had 41 overdose deaths. This year, we have 48. And so that's a 17% increase in total overdoses and overdose deaths. Now, when you separate that statistic and look at the youth component to it, so juvenile victims, this time last year, we had about 5 juveniles that had overdosed. As of today, we're at 13. So it's 160% increase of juvenile overdoses. Thankfully, we don't have any overdose deaths as of yet, but those numbers should be quite alarming. And so to bring context to those statistics and how it shows up now, like I said, we have to, as law enforcement agency, respond to these crises in a different way. So we have to kind of put on a clinician hat. And when we're coming out to these calls and these domestics and these assaults and these shootings and repeat runaways, we know that we have to have a comprehensive tool belt when we're dealing with kids in crises. And so number one for us is intervention. We're focused on intervention with the youth, coordinating and collaboration with resources like the Kellen Foundation, like the Family Justice Center. We know that we need all of the pieces to the puzzle to come together to address the multitude of issues that we have and the multitude of issues that our youth face on a day-to-day basis that we have no clue. And in addition to that, there's a behavioral health component to it, almost 100% of the time. And so we have to be intentional about what we do. Our agency, we have several initiatives that we have implemented. The chief has implemented. It's the behavioral response team. So when individuals are in crisis, when juveniles are in crisis, we have a behavioral health team who specialized in trauma-informed response. And so it's not just we have to arrest our way out of the situation. We know that this is a multi-dimensional crisis that we have, and it is going to take a comprehensive approach with resources to collaborate with our partners. And so we are intentional about it. We have the SOS program, we have the Explorers program, anything that we can kind of break the cycle or interrupt the cycle of trauma for our children. We intentionally try to push those initiatives through law enforcement. We have to be well-versed with dealing with families in crisis, but specifically youth in crisis. And so we focus on children between the ages of 5 to 13 with our Students Overcoming Situations program, and it's targeted to the more impressionable elementary and middle school age children. But we also know that there's the sweet gap, the ages between 14 and 20 that are vulnerable as well. And so we have the Explorers program that we offer for our police department. In addition to that, we know that resources, benefits, jobs, all of those things come into play when we're looking at how crisis shows up in our community. And we know that it is a multifaceted issue that we're tackling. And so we're even having a 500 summer jobs initiative where we're collaborating with businesses in the community. And our chief, we're intentional. We want to employ at least 500 young adults with summer jobs. And hopefully this will turn into lifelong careers and benefits, full-time positions. We have a DECO, a hiring firm that they're collaborating with Ralph Lauren, and they've pledged to employ 150 youth this summer. And we understand that we cannot arrest our way out of the opioid crisis, out of the drug addiction crisis with our families and our teens. And we know that we owe it to our community and our children to think of a better way of how we need to show up as law enforcement. So it's always a pleasure to collaborate with the Kellen Foundation. And I learn a lot dealing with the Kellen Foundation, specifically with trauma-informed care and trauma-informed response. And the more I learn, the more I can bring to the table and help us serve the community in a more comprehensive way. I think that we owe it to the citizens, and I think it's our duty to be multidimensional in how we address all the socioeconomic and everything, all the issues that are prevalent in Greensboro. And the only way that we're going to do that is having a seat at the table, having honest conversation, having thoughtful, empathetic lens on how we address these issues. I know I kind of threw a lot at you, and I know we're pressed for time, but I just wanted to definitely express my appreciation for having a seat at the table. I know that we can make a difference. My colleagues can make a difference. We have pledged you that the chief at the very top, he's pledged to make a honest effort to show up in a community in a different way. And I think we're well on our way of doing that.
Thank you so much for sharing those inspiring remarks. And I really appreciate you lifting up the fact that it really is going to take all of us. As we're seeing, addiction touches almost every service system, every part of our community. And if we're really going to take a kind of a wraparound approach to this, it will require all of us at the table having conversations about how we support and help. So thank you so much for joining us today.
Thank you, Dr. Graves.
Absolutely. And a key player, in that system, in the village, so to speak, as we're building a community, are our Guilford County schools. And so we're really excited to have Kimberly Fields with us today from Guilford County Schools. She's the substance abuse coordinator for the school system, where she's worked in the areas of substance abuse prevention, intervention, and referral for over 20 years. And so we are thrilled to have her join us today to talk a little bit about how addiction shows up in the school system and how Guilford County Schools is positioned to help.
I'm also honored to be at the table and very grateful that Guilford County Schools is asked to be here because anything that happens in our community shows up in our schools. And so we certainly do see addiction. Sometimes we don't know that's what we're looking at. Sometimes it shows up in other ways, as other disorders, as other behaviors. Kids living with addiction, may act out in ways that we would never connect to addiction. Sometimes it's obvious that it's connected, sometimes it's not. But we certainly see that. And whether it's a student's own use of drugs, experimenting with drugs and using drugs, or a student whose parent is addicted, what we know about addiction is that it interrupts the educational process, the academic process, and that's what we do. That's what we're there to do. So part of my job is to use any resource possible in our system, and we have a very large system, to address that barrier, to address addiction as a barrier to education. And certainly you guys and a lot of you at this table and in this meeting are a part of that when we do our referral out. So when we're looking at addiction and substance use in the school system, we kind of address three areas. One is prevention, going upstream as far as possible and doing everything we can from all different directions to address prevention and to implement prevention and enhance resilience and protective factors with our kids. The other is early intervention, and I'll talk a minute about that in a second. And then the other is a referral, intervention and referral. So with early intervention, first of all, let me say, we've got about 73 school social workers. We've got 209 school counselors. We have over 50 school psychologists. We have school nurses, and we also have mental health coordinators in the school system. And so all of those support staff help to intervene in one way or another around addiction and other things that are barriers to education. But our school social workers are our point people in our schools for substance abuse, for the prevention as well as intervention and referral. Often what will happen is that issues will show up in a counselor's office or with a psychologist. And my job is to make sure that those people have what they need to address those issues and refer out if necessary. So the other thing we've got are these early intervention programs. Just like the captain talked about not being able to arrest their way out of it, we know we can't suspend our way out of addiction either. And so What we do is we provide early intervention programs as alternative to suspensions. When kids get caught vaping at school, they're referred to the tobacco vaping education program. And when they get caught with alcohol or other drugs, we have programs for that as well. So our 5th through 8th graders are referred to our adolescent substance abuse program, where they attend school in lieu of being suspended. They actually come to another classroom at another location where they get their schoolwork in addition to some intervention and some evidence-based intervention. So that that reduces the number of days suspended, but it also provides an intervention. And then the high school students, 9th through 12th grade, if they are found to have alcohol or drugs on campus or using alcohol and drugs, then they're referred to the lifestyles program. We contract with Alcohol and Drug Services to provide that program for us. One of the best things about that program is that parents actually attend with the student, and so what's happening is that family system is actually getting some information as well. Again, it's early intervention education. It's not treatment. What happens is for treatment, what we do is refer out. We refer for an assessment through a therapist, private therapist, or community agencies to do an assessment, and then they can determine what level of care a student might need if they're using. So that's a really very quick overview of what we do, but I'm certainly glad to answer any questions, and again, really appreciate the opportunity to talk about addiction, because we know it does show up in our schools and it gets in the way of our kids being successful. So thank you for all that you all do.
Absolutely. And thank you for joining us on behalf of Guilford County Schools to share a little bit about the resources and the programs that are available in the school system. And so if individuals are working with students that could benefit from those programs, we'll certainly provide contact information to reach out to help get kids connected to programs both in the school systems and across our community. And so thank you so much for joining us. As we've been talking about, addiction is a multi-generational issue. And so we have Chase Holloman here with us to briefly tell us a little bit about the Guilford County Solution to the Opioid Problem, or GC Stop program. And Chase, you are welcome to take it away.
Awesome, thank you. And I'm glad to be here as well. And I'll keep it brief and just say that GC Stop, we're a partnership between Guilford County and UNC Greensboro. We've been providing overdose prevention services in Guilford County for the last 3 years or so. And in that time, we've met thousands of people here in Guilford County, all of them at risk for overdose. And I think we all are probably tired of hearing the word unprecedented by this point. But what I'm encouraged by is that despite the unprecedented number of overdoses, we've also had an unprecedented number of reversals. And that's due to the people in our community carrying and using naloxone and rescuing a lot of people. So while things are getting worse, presumably with overdoses, people still have another chance to keep going. And I say that to say that that's not enough. That's just simply not enough. And the thousands of people that we've met in this community all want to do better in their life. All of them do not want to be where they are. A lot of them are the children that we're talking about that grew up and developed a substance use disorder themselves, and desperately want to be there for their children and don't quite know how to yet. And that's why I'm encouraged by the large number of people here today, including non-traditional partners like law enforcement, all talking about how we can come together as a community to help ensure that folks get that opportunity to do better for themselves and their family. And I'm especially encouraged by the Kellen Foundation and the new programs that are targeting youth, because we all know, as we've heard, that it's going to take this whole community to do this, especially starting with our children is a fantastic starting point. So I'm glad to be here. Thank you.
Thanks so much, Chase, for sharing. And we'll make sure to put the website and information about GC Stop as a resource in the chat box and also in our follow-up email as well. And so to just as a direct follow-up from that, a lot of the conversation we've had today, we've been hearing in our community and really wanted to try to fill a gap. The Kellen Foundation launched to try to address gaps in our community and not reinvent the wheel. And one of the gaps that we were hearing about was specifically related to youth and addictions, youth and substance use. And so kind of as a complementary program to GC Stop and to the other programs that are available in our community, the Seeds of Hope program is launching specifically to focus on youth impacted by the addiction crisis. And so this particular program is a multi-year funded program supported by the Office for Victims of Crime. And it includes a multidisciplinary team that includes myself as a clinical psychologist and team lead for the project, our clinical team lead and our deputy director at the Kellen Foundation, Leland Wingfield, is part of that team. Emily Wall is our primary clinician on that team, and she's an LCAS and very knowledgeable about addiction and youth. And then we also are building in a peer support specialist, recognizing and realizing that clinical supports are important, but also working with folks that have lived experience is also essential. And so trying to create a multidisciplinary team that can help folks in a variety of ways. So as we wrap up today, I'm going to show you this brief video, which gives you an overview of the program, as well as how you can refer somebody, eligibility, that kind of thing. And then we'll, after the video, we'll wrap up with any questions or comments. So I'm going to play this now.
Hi, my name is Dr. Kelly Graves, and I'm the Executive Director and co-founder of the Kellen Foundation. The opioid use and addiction crisis has reached every corner of our community. In fact, according to national statistics, almost 20 million Americans every year battle with substance abuse. We often think about addiction as an adult problem, but substance use issues affect people of all ages and can be felt by all family members. And so the science tells us that what we need to do is go upstream and tackle addiction using a multi-generational approach. That's why we're excited to share a new program for Guilford County called Seeds of Hope. Seeds of Hope recognizes the trauma and potentially long-lasting impacts addiction can have on children and adolescents, and aims to provide them with support and services that they need to survive and thrive under incredibly difficult circumstances.
We have a wonderful team at the Kellen Foundation, and we're excited to have a mixture of familiar and new faces for our Seeds of Hope program. You've already heard from Dr. Kelly Graves, and I'm Leland Wingfield, a counselor and addiction specialist by training, and I serve as the team lead for Seeds of Hope. We also have Emily Wall joining us as our primary clinician. Emily is a licensed clinical addiction specialist associate, and she's very passionate about serving children in need. Another familiar face will be Madonna Campbell-Greer. She's our certified peer support specialist. Our team continues to be supported by Mackenzie Stenberg and other Kellen Foundation staff members.
When considering who our program is serving, we're looking to offer services to anyone 0 to 18 years old who has experienced adversity or trauma and is either struggling with addiction themselves, has a loved one struggling with addiction, or has witnessed a drug-related crime. When looking at our services, we're striving to provide case management, advocacy, comprehensive assessments, and individualized therapy. We will also provide peer support, which Madonna will talk more about.
Thank you, Emily. In our two-generational approach, we are offering peer support services to the parents and caregivers of these children. I will be helping the parents learn to navigate the system, and I will help them learn to advocate for their children.
Now that you know some about who we serve and what services we plan to provide, we'd like to share that making a referral is super easy. Anyone can refer a child in need of our services. A phone call to the main Kellen Foundation number at 336-429-5600 can start the screening process. We also accept referrals electronically through our website, which is kellenfoundation.org. You can find our electronic form there, along with a printable copy if you would prefer to fax.
We're delighted to offer this cutting-edge program and partner with amazing groups across Guilford County to collectively address the opioid crisis. We are supported by the Office for Victims of Crime as one of only 17 sites in the country. It is our hope that the Seeds for Hope initiative expands our community's capacity to address these needs, prevent further addiction, and help children, adults, and families move from crisis to wellness. For more information, please visit us at kellenfoundation.org. All right, so as we wrap up today, we will just open the floor now to any questions, comments, ideas, anything that folks would like to add. And again, we will share the referral link for the new Seeds of Hope program, as well as resources that we've talked about throughout the hour. And just really want to lift up and express appreciation for everyone that was able to join today. I really do think that if we work collectively together and think outside the box, we can around the box, in the box, all of the different locations, we can come up with some innovative ways to get those numbers down that Captain Martis shared. 55% increase in the last year is telling us we need to think differently about how to address it. And so thank you so much for joining today. Feel free to pop off the call if you need to. Otherwise, we'll stay on the call if there's any questions or comments that folks would like to lift up. All right, as folks are logging off, for those that are still on, our next meeting is tentatively scheduled for July 7th. We're doing some polling to make sure that July 7th still works for folks. Typically, our meetings are the first Wednesday of every month, and they're open meetings, welcome to everyone. So we encourage you to join us back in future months. If you'd like to, you can also join our Resilient Guilford Network page on the National PACES Connection site. Which was formerly ACES Connection, but now it's changed its name to PACES. And so we're part of the community, the national community there, really focusing on how do we build positive experiences for youth and address ACEs. So just linking that into our chat box too, if you'd like to join that. And finally, as we wrap up for the day, we'd love your feedback. We want to try to create meetings and conversations and action steps that are responsive to what the community says it needs. So feel free to share any feedback, thoughts, suggestions, action steps that you think would be beneficial for us and for our collective collaborative moving forward. All right, and that is all for today. Thank you so much, everyone, for joining today. And we hope that you join us back next month and continue to be in touch as we work towards addressing trauma and addiction in Guilford County. And thank you to all of the speakers that were able to join today as well.
Thank you, Kelly. Bye.
All right. Bye, everyone. Take care.
Thank you.